Hi, I'm Dr. Brent with the Family Chiropractic Centre in Guelph, and today I'm going to go through how to use a Denneroll to correct your cervical curve or your neck curve. So part of the thing that you have to understand is that most people don't have a normal curve in their neck after years of postural stress and concussions and whiplash traumas. The normal curve of your neck should be a C-shaped curve. So we call that the arc of life, because if you do have that normal curve in your spine, it allows all the messages from your brain to flow through your spinal cord and down to the rest of your body, so your body can function and heal and recreate itself the way it's supposed to. But a lot of times when we take x-rays, we'll actually see that you've lost some of the curve. Maybe your neck is straight. Some people even have the neck curve reversed. And so even if you're standing nice and tall, you may not have a good curve. So chiropractic care alone, sometimes with better posture, allows that to be restored, but most times you've got tension in the ligaments, memory patterns in the muscles that need to get retrained to help bring that curve back into normal alignment. So one of the things that we use in our clinic is called a Denneroll, and it kind of works like a toothbrush. Owning it, not using it isn't going to help. So it's got a funny name. It's called a Denneroll, not a dinner roll. You don't want to eat it. But the key thing is that you need to have care for maybe a couple months just to help balance your spine before you can use it. And then the idea is that you want to lie down and do this every single day. And you want to do it for an increasing amount of time. The target is to get to 10 minutes. So let's say you're laying on your back and let's say you don't have a good curve, maybe it's straight, maybe it's even reversed. You're going to lie there, and I'll demonstrate in a second. And then your upper mid-back is supported, and just going to drape your neck over there. It's going to allow your discs to open up. It's going to stretch the ligament at the front of the spine here to train a curve back into that nice C-shaped curve, that nice banana curve that you should have. When that curve is restored, we'll actually be able to see it on the x-ray. So your first x-ray might look like that, and then you'll start seeing, and we can actually measure the angle change. Normally 40 to 45 degrees is a healthy curve. Some of you might have a 10-degree curve, 20, 30-degree curve. Some people even have negative curves, and so the worse that is, the further away it is from 43 degrees, which is kind of the average there, the more pressure's on your cord. So the key is to lie on this little Denneroll and stretch the curve back into your neck. So I'm going to show you how to do it. So you want to do it on the floor. You don't want to do it on your bed. You want to have a relatively firm surface. A yoga mat's perfect because it'll stop from slipping around. If you don't have a yoga mat, you can do it on the carpet, that's fine. I wouldn't do it on hardwood. You want to have something pretty stable with a bit of padding. So you're going to put it down there and you're going to lay down, and the package insert shows different positions. The default position is where you'd actually have the top of the little block in line with the top of your shoulders. Some people who have reversals and their neck might have to use different positions, but don't follow the package insert. Listen to what I told you or your chiropractor told you where to place it. But I'll show you the default position today. Bending the knees takes pressure off your lower back. So if I reach back, I feel it there. I'm just going to let my head rest back. So your head might actually float a bit off the floor. That's okay. Or it might rest on the floor. But you want to avoid putting it right on your neck. If you start noticing numbness or pain in your head that's giving you a headache, it's probably too high. If you have any pain while you're doing it, stop and talk to me if you're my patient, or talk to your chiropractor when you see them next. But you should feel a bit of a stretch, a bit of an ache as you're stretching those ligaments back into normal position. So just lie there, get a timer going, and you want to just do it, if you're beginning, just for a minute at a time. After a minute, you're going to roll off, take it out, and then lay back with nothing. Just let your neck relax, okay? And then get up. It's just easier to get up after you've let your neck relax for a bit. And then you do it every single day for a week. Start with a minute, nice and easy. At the end of a week, if that was good, try 2 minutes every day for a week. If you can't get through a whole week, just hold off and continue doing it, whatever that was. Every time you get through a week, you can add another minute, or if it's been relatively easy for you, you can add a couple minutes. The target is 10 minutes. You can do it up to 20 minutes. I have some ambitious patients, and they're doing it like 20 minutes a couple times a day. Great. I wouldn't do it for any more than 20 minutes at any one time. I also wouldn't do it fresh out of bed. You kind of maybe want to tie it to something that you're doing every day. Maybe do it after the shower, maybe do it before you go to bed. but you should have your tissues warmed up a little bit. Don't do it fresh out of bed. It's a very effective way to help train the curve back into your neck, but the key is that you have to do it consistently. As long as you're able to do it regularly, you'll see change on your x-ray. Once you've done it for a couple months, let's say at 10 minutes, then it's worth taking another x-ray. Okay, so that would be the first one, and then on a regular basis, we'll take an x-ray to make sure everything's progressing the way we want it. So there's a quick review on the Denneroll. If you've enjoyed that, just subscribe to the link below. Leave any comments that you have in the comments section, maybe even videos that you'd like me to do in the future. Happy to help you out with there. I'm Dr. Brent. Make it a great day.